Hello everyone, today I'll be showing you how to insert a Foley Catheter. I'm just going to go ahead and adjust the camera so you'll be able to see me during the whole procedure. Okay, I have all my stuff, the stuff that I need here. First thing, what I'm going to do is I'm going to go ahead in the room, introduce myself, verify the patient, and provide privacy. And of course, I'm going to explain the procedure that I'm going to do. Okay, wash my hands. I'm going to go ahead and wear my clean gloves. And ask the patient if we will ask if the patient is comfortable. And then what we're going to do is after we apply the clean gloves, we position them, we lie them flat and knees bent, I'm sorry, and then we're gonna do a pericare. Okay, so I have my washcloths here. I pretend that I have all my stuff here. So I'm gonna go ahead and wash one stroke on one side. This is gonna be trash. I have my trash there. Another one. Wash the other side, trash, and then another one in the middle. Open it clean, trash, and now I'm gonna go ahead and pat dry. One stroke as well. It's gonna be trash. Another one on the other side, trash, and then one in the middle. I'm just gonna move it a little bit so you can see, and one in the middle. Okay. And then now after I clean this, now I'm gonna take off the clean gloves and trash it, and then I'm gonna go ahead and open my sterile field. Okay, and here is my sterile field. Let me just adjust it. And I'm gonna use this as a trash bag. So I'm just gonna leave it here. Okay, so I'm just gonna go ahead and open without touching the inside part, like this. So here I have my sterile field. I make sure I position my patient. Like to make sure that I'm like not going back and forth. So I position my patient. I have my sterile field, and what I'm going to do is I'm just going to go ahead and apply what is it called? Apply the sterile gloves. Okay, I'm just going to put it like this. Put it out. And after I take off my clean gloves, I washed my hands, okay? Just gonna move it inside. Touch this. Make sure you don't touch the inside part of the sterile glove. I'm gonna go for this part and put on my other hand. And then after I put it on, just make sure you can do this to adjust it. Okay. This is trash, or I could have done it in here. I'm used to do my trash on the side, but I could have just trashed it over there. So I'm gonna take off the brick I have and place it under the patient's hip, or like in the under the legs. So just for the inconvenience, I'm just gonna pull this up So you can hold it for me. And I can put it like that. And I have this part, so I'm just gonna drop it because we do not want it to break the sterile technique. And then I have my stuff here. I have my swab. So make sure you put it in your sterile surface. This is for collecting specimen or urine culture, but we're not going to use it, so I'm just going to trash it. Okay, here's my stuff. I have my catheter here. I'm not sure if you can see it. Oh my goodness, I'm moving. So before I do this, I'm going to go ahead and explain the patient what I'm going to do and what the procedure is. So I open my alcohol swab. I have 3 of them, 1 stroke for each. And I have my trash there. I'm gonna put it in my trash. Gonna get my syringe, connect it with that, open it, trash, and connect it here. And then I'm gonna open my lubricant gel. And then gonna take out my catheter. And just remember it's sterile. Put this trash. And then I'm just gonna put it in the lubricant gel like this for now. And then I'm gonna go ahead and I'm touching the inside, you can touch. So what I'm going to do is I'm going to go ahead and start cleaning. Okay. So if I do this hand, I'm gonna block you. So if I do this hand, I might block you. So I'm gonna do with this hand. So what I'm gonna do, I'm gonna go ahead and open the labia so I can clean it really good with this alcohol. If you can see it. So I'm gonna go ahead and just clean it. So 1 stroke. So I'm gonna clean this side. So I'm gonna trash it, clean it the other side, trash it, and clean the middle part and trash it. So now this is not sterile anymore. So I have to keep my hand like that. So I'm just gonna get the my catheter tube and push it down there. Open it a little bit more. You can see I'm putting it 5 to 7 centimeter. And always make sure you see the patient, you ask them, because this is very uncomfortable. So make sure you ask them how they're feeling, if they are comfortable. And then when do we stop is that when we see a urine is coming out, it means it's good, it's on the right spot. That's when we stop. And then after that, we're just gonna go ahead and inflate the balloon. Because before we inflate the balloon, we see a urine come out. That means if you see a urine is coming out, it means we're putting it on the right spot, and it's a good time to go and proceed inflate the balloon. So we're gonna put the whole amount that is in the syringe to inflate it. So I'm putting everything that is on the syringe. Okay. I'm actually putting it in. So make sure. So you always make sure you pull the catheter into the resistance, and then after that, right after we do that, we're good. And then I put everything in there. What I'm gonna do, make sure you don't leave the syringe in there. If I leave the syringe, see what happens? It's coming back. So we make sure we don't do that. So right after we finish, we take it out. We're done with this one. That's going to be trash. And now the drainage bag, we make sure, oops, my computer is off. Sorry, my computer is off. And then here we have the catheter bag. So we make sure you put this below the patient, below the bladder. And then I'm just gonna hang it here so he's here. Okay, we hang that one, and then what? I'm sorry. And then we have to clean our things. So what we're supposed to do is we can just, because we can't take it out like this, right? So we can just rip it off, take this out, and take everything is gonna go trash. Remove my sterile glove, position the patient, ask them if they're I'm just gonna put the camera on my face. So ask the patient if they're comfortable, if they don't have any pain. You ask them, and then if they're good to go, make sure you position them, ask them the comfort, and then you take off. You do this after you wash your hand. After you take off the sterile glove, you wash your hand, position. Ask them for comfort if they need anything, and then if they're good, you undo their privacy. Make sure you wash your hand before you leave the patient's room. You document the procedure you did, and procedure completed. Thank you very much.